Greetings, staff, and welcome to our State of the Hospice presentation and recognition award celebration. This past year has definitely been an extraordinary year. In January of 2020, the World Health Organization proclaimed that this year would be recognized nationally as the Year of the Nurse. What a coincidence and what an understatement. On that note, we had every intention of rolling out quarterly and end-of-year recognition to honor our outstanding nurses who made exceptional contributions to the hospice nursing profession. But due to the pandemic, all our intended plans were set aside, and we have been dealing with something that none of us could have anticipated or even imagined. Through it all, our nurses and all of our clinical staff and administrative staff have performed flawlessly, all of you, under very difficult conditions. You, our team members, have enhanced the image of professionalism and rose to the unprecedented challenges facing this organization with compassion and respect. As if the pandemic wasn't enough, we've also experienced a year in which there has been much turmoil in our country. We've had to reckon with our nation's inequities regarding race, our economic crisis and uncertainty, and a high-stakes election process filled with so much division. I don't know about all of you, but sometimes I think, how do we get through this on a day-to-day basis and for the long haul? Because we have no idea when it will all be better. But I know that resiliency is somewhere in that solution to staying the course. I know that because I've seen resilient leaders in this organization from the people that I directly work for. I realize that I am employed here to work directly for all of you, and I take our mission seriously, as I know all of you do as well. The group of leaders that I work with and for every day, the senior management leadership team, are an amazing group of people. And I'd like to introduce each of them to you now. Dr. TRACY Romanello, our medical director. TRACY has been a driving force in keeping us honest. She's kept us up to date on CDC guidelines, continuously problem solving and creatively responding to the challenges that I'm sure she never imagined when we embarked on this journey together. I thank Dr. Romanello for her resiliency, her focus, her leadership, and her partnership. Thank you, Dr. Romanello. Barbara Slowick, Senior Director of Business Operations. Barb mentioned to someone the other day that she had worked with me in 4 other companies. That comment reminded me of why, because Barb gets things done. She is the hardest working woman I know, and I appreciate her tenacity, her thoughtfulness, her logic, and her commitment to never letting up until a job is done. Thank you, Barbara. Hyacinth Hamilton, Director of Clinical Services for Dade County. At her core, Hyacinth is a caregiver, and her strengths lie in ensuring that patients and their families get the end-of-life experience that they deserve. She knows what that experience should look like as a former bedside hospice nurse. She will run the extra mile, literally, going out to visit our clients whenever there is even an inkling that something might be of concern to them. Hyacinth is dependable, approachable, and as I love to hear her say, she is built, bored, tough. That she is. Thank you, Hyacinth. WILMA Forbes, Director of Clinical Services in Broward. When WILMA came on board, I recognized this quiet intensity in her that I loved. She focused on an issue independently, methodically, and quietly problem-solved and worked through everything thrown her way. She is a resilient leader that cares tremendously for staff and patients alike, and Wilma is someone that can be counted on no matter what. Thank you, Wilma. Dr. Rochelle Clarke, Director of Quality and Organizational Development. We are all grateful to Rochelle for her assistance with guiding us through managing stress, helping us come to our own self-realizations, whether work-related or personal struggles. Rochelle assists us in every way to keep us moving in the right direction. She is expert at addressing family concerns and is super responsive so that issues are addressed with immediacy. Those conversations are some of the most complicated, but Rochelle is always cool, calm, and collected in every way. Thanks, Rochelle. Laura Del Toro, Director of Human Resources. We miss Laura and her megaphone. Kudos to Laura for navigating through the payroll changes and the change to Paylocity. The system is easy, but I can assure you that converting over was not. But Laura never gives up or gives in to the pressures of the day. She continues on and tries to find solutions quickly so that we can all serve our patients and families. Thank you, Laura. Michelle Espinosa, Director of Finance, the master of spreadsheets and numbers. Michelle performs the difficult task of analyzing our results monthly, quarterly, and yearly, budgeting each fiscal year for us, and responding to our multiple requests for this report and that report so that we can create plans, strategies, and activities that will move us forward. Thank you, Michelle. BEATRIZ Hernandez, Director of Facilities and Accounting. B is the keeper of the checkbook and the controller of Michelle's budget. She reminds us of our spending and pulls our reins in when we get super creative. B is consistent and responsive. Her immediacy in problem solving is remarkable and quick. She will never allow an issue to sit too long without addressing. B is super dependable and can always be counted on. Thank you, B. Jessica Joseph, Manager of Philanthropy and Public Relations. Well, what can I say about Jess other than that she is my right hand? She is involved in every task, project, work detail. I depend on her greatly, as we all do, and I so appreciate her guidance, her commitment to excellence, her dedication to the organization, and during this time of challenges, her steadfastness. Thank you, Jessica. And now let's hear a message from Mr. Joe Catania, President and CEO of Catholic Health Services.
Good afternoon, everyone. Over the 30-plus years in the history of Catholic Health Services, we have faced many challenges, and each and every time we have banded together, fought hard, and got to the other side, stronger and more committed to each other and our mission. Yet this is a time like no other in our lives. The COVID-19 pandemic continues to produce uncertainty, stress, and trauma. We have all been impacted by this virus, which has been devastating for so many. Despite the challenges we are all facing every day, this is also a time that is bringing out the best in many people. Every one of you has stepped up and done what was necessary for your families, your team members, the organization, and most importantly, you continue putting the needs of your patients and their families first every day. There's a saying that when the going gets tough, the tough get going. Well, you can take satisfaction in how together you have also strengthened our mission by hitting record high census numbers and taking on new projects to improve the operations and care delivery systems for Catholic Hospice. Your can-do attitude during these unique times has been nothing short of inspiring. I am humbled to work alongside such a dedicated team of professionals and appreciate your continued commitment to each other and the mission of Catholic Health Services. I especially like to thank DIAN for her commitment and passion for Catholic Hospice, each one of you for your dedication each and every single day in the face of unbelievably extenuating circumstances. This has been a time like no other, sitting, doing virtual meetings. Just to show you here, we have this screen, some notes, nice tie, in my shorts, over at my daughter's house. But sincerely, I'd like to thank each and every one of you for your dedication. We understand you could have great difficulties in attending to patients during this crisis, considerations for your family also. Thank you again very much, sincerely. Thank you.
And at this time, I'd like to introduce to you Mr. Artie Palin, our boss, Chief Operating Officer, Catholic Health Services.
Hello, I am Artie Palin, and I wanted to thank you for allowing me a few moments to speak on this special occasion. This year has challenged us both professionally and personally like never before. And yet through all of the challenges, all of you have been able to focus on keeping our patients safe, on keeping them well treated, and on keeping each other safe and supported. I again come to you not only as a colleague, but also as a recipient of the services. My family and I, again, have seen firsthand what Catholic Hospice does for our community. For that, we are eternally grateful. I look forward to a year in which we have continued progress and we continue to support each other. But most importantly, we continue to grow the legacy of Catholic Hospice. Stay safe and God bless and thank you.
Hello, Catholic Hospice. My name is Steve Hill, and I'm a client services consultant for State Serve Medical and Hospice Link, and I look forward to working with you as your single point of contact moving forward. I will be able to help assist with DME track training and also setting up new users in the system. I'm a great resource for single patient agreements and also finding new DME that is very unique to maybe patient-specific needs. If you have service incidents reports, I will also report back on those findings. And as a corporate structure, I will be offering monthly meetings for an open forum to help discuss anything that's going on in the industry. Also provide quarterly business reviews where we analyze utilization and opportunities for growth. And also, I wanted to let you know we also help with disaster planning. This is just a short list of items that we do assist with. And again, I'm looking forward to working with you.
Greetings, ladies and gentlemen. I'm Gary Vasquez, Area Director of Operations for the East Region, State Serve Hospice Link. I'd like to extend you a warm welcome in joining our mission in providing exceptional quality care to hospice patients. If I may share, I've been with State Serve now for 10 years. I built my DME and operations career with this company, proudly serving both the local and national markets across our network umbrella. I'm actually based out of the Miami office and have been for most of my stint with State Serve. Therefore, I'm very familiar with the local elements, demographics, hurricane preparations, which are so relevant to our city and state. I'm very excited to have the opportunity to demonstrate our DME operations, the quality of our service, our dedication to patients. If at any time you have any questions about our operation, please feel free to contact me. I'll be more than happy to provide support. My number is 305-962-6430. Again, welcome, and I hope to meet you soon. Thanks.
Hi, my name is Enrique Martinez. I'm the Senior Site Manager for State Serve Medical Miami, and I have been with the company for 10 years. We are very excited about this partnership with Catholic Hospice. We have a great group of techs that are customer service oriented. Our aim is to make sure that we provide quality care for your patients and for your staff. It would be great to meet in person once it's possible, and we can answer any questions that you may have about how we operate or our emergency preparedness plans, for example. Don't hesitate to give me a call if you need anything. My number is 305-807-3862. Thank you.
I am Hyacinth Hamilton. I'm one of the clinical directors here at Catholic Hospice. I am honored to introduce our staff members celebrating 5 years of service with Catholic Hospice. Over the last few years, we have developed new programs, outlined new initiatives, and dedicated our work to the mission of this organization. We are successful because of your talent and expertise you bring to this organization. It is with pleasure that we recognize your 5 years of service. Congratulations to all our employees celebrating their 5 years of service.
Hi, it's an absolute pleasure to be here with you this year to celebrate our staff members who've dedicated 10 years of service to Catholic Hospice. Your commitment to our mission and loyalty is truly commendable. Over the years, you have committed to making our hospice one that is known for the compassionate service we deliver to all who are in our care. Thank you so much for all you continue to do, and it is an honor to announce our staff members who have given 10 years of service. Congratulations.
Can you believe that it has been 20 years since some of us chose Catholic Hospice as an employer? For those of you who have dedicated the last 2 decades of service to serving our patients and the community, we say thank you. It is because of your loyalty, insight, patient care, and belief in us that we can be the organization we are today. It is an honor to introduce to you all staff members serving Catholic Hospice for 20 years. Patty Gottardi, Manager, Continuous Care. Mercedes O, Hospice Aide, Pink Team. Fritzner Polynice, LPN Runner. Juan Rubio, Office Services Coordinator. Dr. Benjamin Villalba, Hospice Physician. Brenda Westcott, LPN Continuous Care. Congratulations on your 20-year anniversary. Thank you.
I would now like to recognize 2 employees who have achieved the 25-year milestone. We sincerely appreciate the hard work and efforts that it takes to dedicate 25 years of your life to an organization. We are sure that you have never thought that you would celebrate this milestone in the middle of a pandemic, yet you are working through it with grace and passion. Thank you for the wonderful years of your life you've shared with us. You are the foundation of our success, and your contribution is immeasurable. From all of us, it is our personal appreciation for your achievement and all that you have done over the years to build Catholic Hospice. Thanks to these 2 amazing employees celebrating 25 years of service, BEATRIZ Hernandez and Germania Smith.
As the Medical Director for Catholic Palliative Care Services, I want to recognize the hard work and dedication of an incredibly skilled and talented team of palliative providers at CPCS. We have an amazing practice that includes nurse practitioners, Giselle, Eustacy, Mary Helen, Stephanie, physicians and Dr. Kashan, Dr. Skelton, Dr. Gerhardt, Dr. Robles, Dr. Dada, and Dr. Pius. Social workers DIAN and Marcia, chaplain Chris, nurse navigator Art, and practice manager Marilyn. We provide palliative care services at 3 hospitals, including Mercy Hospital, Holy Cross Health, and Aventura Hospital and Medical Center. The palliative program supports hospice success, with these 3 hospitals driving an abundance of referrals and admissions in continuity of care. I want to acknowledge this team's tremendous dedication and over the past year, and in particular their COVID response, so thank you. I'd also like to share wonderful news about 2 palliative award recipients. Art Hoff, the palliative nurse navigator at Holy Cross Health, was recognized by JetBlue earlier this year. He won the JetBlue Healthcare Hero Sweepstake with a nomination that described his selfless attitude and service to those in desperate need. Congratulations, Art, for being a grand prize winner and a wonderful and great team player. I also want to share some news about another award recipient, our palliative nurse practitioner, Eustacy Caraballoso, for receiving the prestigious 2020 South Florida Hispanic Chamber of Commerce Miguel de Cervantes Award. Eustacy is recognized for her outstanding leadership and service in palliative care supporting the community. She also received a Faculty Teaching Award in June for supporting the training program and education at Aventura. Congratulations, Eustacy. I also want to acknowledge Dr. Sanaz Kashan for graduating 2 fellows in June, and share that beginning mid-October, Dr. Kashan will assume an expanded role in palliative care. Again, this is a world-class team, and every member of the palliative family is incredibly valued and appreciated. Finally, I want to commend our hospice physicians for their ongoing support of our services, our patients, and families. They do a phenomenal job. I'm fortunate to have a great physician base, And I'd like to specifically thank Dr. Singh and Dr. Vialba for their leadership and support. And I thank you so much, doctors.
Now it's time for our Hospice Heroes Award. Catholic Hospice employees contribute vitally to service excellence. The Hospice Heroes program recognizes employees for their contributions to patient care excellence, customer service excellence, compassion, and commitment. A hospice hero is an employee who is a high performer, recognized for their leadership, their teamwork, adaptability, innovation, and a positive attitude. Now let's listen to the Hospice Hero story.
The definition of the Hospice Story Award is for a clinical staff who provides the highest quality patient care service to our patients, families, and to the community. It recognizes a clinical staff that performs over and above the standard expectation of their clinical role. Deliver patient services which are safe, have measurably effective clinical outcomes, and provide a good experience for patients and families. Act in a humanitarian way by doing the right thing for another person, patients, caregivers, and family. Demonstrates professionalism in their approach to work and strive to achieve the highest standards of clinical excellence. Now, let's hear the story for this award.
I'm honored to read the meaning of the Outstanding Contribution Award. The Outstanding Contribution Award is for an employee who positively influences others in working towards departmental and organizational objectives, actively participates in fostering others through change initiatives, invests time and effort in coaching and/or mentoring by serving as a role model to others through positive interactions. And now, let's hear the story for this award.
I'm honored to read the meaning of the Consider It Done Award. The Consider It Done Award is for an employee that promotes positive morale through actions of good spirit, provides a unique level of service that fosters business and further enhances company reputation, seeks opportunities to share valuable resources, achieve the desired outcome despite adversity, provides high-quality service to our employees, patients, families, and the community, ensuring all employees, co-workers, patients, and families are treated fairly and respectfully. Now, let's hear the story for this award.